Good afternoon. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine, and I want to welcome you to today's webinar. Our webinar is sponsored by the ACVPM and its partner organizations, the National Association of Federal Veterinarians, the American Association of Food Safety Veterinarians, the U.S. Animal Health Association, and the National Association of State Public Health Veterinarians. It is my pleasure today to welcome Dr. Cheryl Stroud. Dr. Stroud has enjoyed professional experience in the poultry industry, academic research and teaching, private veterinary practice, and is a One Health change maker. She accomplished her DVM with the first graduating class out of Mississippi State University, and briefly saw mixed animal practice before returning to academia for a master's and PhD in endocrine physiology at North Carolina State University College of Veterinary Medicine. Later, after years of research, she returned to small animal practice before discovering her passion for conveying the urgency of implementing One Health thinking, acting, and decision making at all levels of society. For the past 12 years, she has served as Executive Director of the One Health Commission, a nonprofit organization chartered in Washington, D.C., and headquartered in Central North Carolina. The One Health Commission works globally to connect One Health stakeholders to create teams that work together across disciplines to educate about One Health and One Health issues. Through its volunteer working groups, its programs provide opportunities for individuals and organizations to work together across professions to educate about One Health and One Health issue. Dr. Stroud, I will turn it over to you. Thank you.
Thank you, Eric, and thank you to the ACVPM for inviting me and allowing me to share some of my One Health passion with you guys. So I'm assuming everybody can see my screen in full slide, and I'm going to ask everybody to hold on to your seats. I have a lot to share with you, and I'm going to talk fairly fast. I will provide to Eric a link to a PDF of these slides afterwards, because you'll notice I have lots of links on all these slides if anybody wants to delve into something I only had a chance to just mention in passing, if you'd want to delve into it just a little bit more. So with that, let's see if I can advance here. I bring you greetings from the One Health Commission, and our priorities are and have been for quite a while to connect One Health stakeholders, to create teams and networks, to work together across disciplines, to educate about One Health and One Health issues. So now you've heard that from Eric, and you've heard it from me. That's the gist of what the One Health Commission does. And I always try to thank all the organizations that have financially supported our work. There's no way that we could do what we do without the support of all these organizations. And I'm going to just right up top in front here urge you to sign on to the listserv to receive the monthly, well, it's about monthly, One Health Happenings newsletter that shares news, One Health news from all around the world. Most organizations, their newsletters share what they're doing, and that's wonderful. We actually link to a lot of newsletters in this one. But this newsletter shares One Health news from all over the world because really no other organization was doing that. And we found it really, really necessary to start trying to connect us better so that we could find each other, identify our strengths, find our synergies, and find ways to join hands to further this movement. So, and I notice on this slide, it says the listserv's around 22,000. I was in the listserv yesterday, and it's up over 23,000 now. So it's more than double since the pandemic, when the world kind of started waking up to what this whole One Health conversation is all about. What I'd like to do in our time today is give you just a really, really quick high-level overview of the arc of the global One Health movement. I'm hoping that you can sort of start recognizing some of the major players, because there can be confusion. And then we'll suggest some needed actions and try to highlight the role of veterinarians. Now, I realize most of you listening are going to be from public health. My comments at the American Veterinary Medical Association were more targeted toward clinical practicing veterinarians, but everything that I have to say for you here today will be even more powerfully applied to you guys. As you know, it's not a new concept, but it is a new professional imperative we're actually resurrecting an ancient wisdom that most indigenous societies have baked into their DNA. So this is not new. It's just that our systems have forced us into these silos. So I like to refer today to One Health as a ray of hope for the future. And we have discovered over the past 20 years of this conversation that there are so many arenas and topics that are begging for us to address them and meet the challenges using the One Health way of thinking, acting, and decision making, making sure that all the players are always at the table. So, one of my talks actually goes into examples and stories from a number of these, all the way from animals as sentinels, which we may mention today, to climate change, to comparative medicine, translational, comparative biology and translational medicine, food and water safety. All of these are arenas that are begging for this One Health approach, even though it was zoonotic diseases that really kind of put it on the map to begin with. So that's our challenge, is to find ways to use the One Health way of thinking to address so many challenges. And I do have a couple of take-home messages. I hope that they'll really resonate with you. No one profession, no one discipline can know everything. And we really do need to collaborate and find ways of sharing information better across our disciplines. But in our current systems, the relationships that we need are not just magically going to happen. We are going to have to step out of our comfort zones and go and mix and meet with and have personal conversations with people in other disciplines. So that's one of our challenges and one of the take-home messages that I hope will really resonate with everyone. The other really main message is that for this to happen, for us to really fully realize and implement One Health, it's going to take both top-down and bottom-up actions. And so by top-down, I mean support from government structures, which are incredibly necessary to provide the opportunities, the funding structures for grant opportunities and supporting local efforts. But we really do have to have the bottom up, which is from the local, engaging communities, finding out what the problems are, engaging community leaders, and really educating the general public, the plumbers and electricians and school teachers about this concept and this way of thinking. So I really hope that you'll keep those in mind. Those are some major take-home lessons from what we're going to talk about today. So I know everybody on this call probably understands and believes in One Health. The big question is, what can we do? We've been yelling at each other as scientists for 20 years about One Health, but we have not yet found a way to really help the general public understand it. So we have a lot of work to do yet. We have a long way to go yet. So, a real quick few words about this global One Health movement. I know many of us working in the US get so focused on what we're doing in our jobs that it's kind of hard sometimes to realize what's going on around the world for One Health and to kind of see where what we're doing fits in and see the gaps and what we might do to help with some of the gaps. So I hope you don't get vertigo, because we're going to be zooming in and out from the US to international and back to the US. And I will mention that everything I'm going to talk about today has all kind of been happening in parallel for the past literally 25 years. So bear with me if I run a thread forward a little bit and then drop back, and just to catch you up to date as to how things were kind of all happening simultaneously in this space. As I mentioned, it's a very global movement. And if you haven't seen this map on the Commission's webpage, I urge you to go take a look. It's something I've been working on now for over 10, 50, 40, 12 years, I guess, to try to find out who's doing what from academia, from government and intergovernmental agencies, from nonprofit associations, and even for private corporate for-profit organizations. So you can actually see maps broken out for each of those. And I just show you this to give you a feel for how much is going on around the world. And you'll see something similar again in the moment. I just try to remind people, I don't usually dwell on this slide when I'm talking to people who understand One Health, but I was speaking to a public health department recently, and I asked them how many knew the name Rudolph Virchow, and two hands in the room went up out of a room of about 50. I was shocked. And so I'll just mention that even Hippocrates back in 400 BCE was talking about airs, waters, and places, and Rudolph Virchow who we know said between human and animal health there is no dividing line, nor should there be, and William Osler, the father of veterinary pathology. We're really all standing on the shoulder of giants. And I will mention and pause here just to talk a little bit about Dr. Steele, because I want you all to be aware of this book. If you haven't read it, I urge you, especially from public health, to go read this book by Craig Carter, my close colleague. It's amazing the depth of knowledge that Dr. Steele had and how he used that knowledge not only to create CDC's veterinary public health program. He was the first veterinarian at CDC in 1947, but also internationally he was involved. So I urge you to pay attention to his little book. And then I'll mention Calvin Schwab because I was in that public health group, and nobody in the group knew who Calvin Schwab was. So I have to mention it for people who are strictly from public health. But I guess this is a veterinary preventive medicine. So most of you guys will be very, very familiar with these gentlemen. And I'm just mentioning Schwabi because I just want you to be aware of his books, and you can find them on our website. And you can, I don't know if you can still get copies of them, but just mentioning it in passing because we are literally standing on the shoulders of giants these days. So many of you will know, since you are in public health, that starting back in around 2003, Joe Anelli, who was at USDA APHIS at the time, I guess he was pulled over to the State Department for conversations about, remember the avian influenza scare and the SARS scare in 2003 and 2004. And he was the veterinarian in the back of the room that would raise his hand and say, these diseases come from animals. Don't you think we need to get some of the animal health people in the room? Because there weren't any. And so he started a very informal federal interagency One Health working group starting in around 2003 or 4. And for the next over 10 years, he very informally led, and people who were working in the different agencies would come together. Back in that day, it was teleconference, and talk about the things they were working on and how they fell in the One Health space and how they might collaborate. So that's a little piece of history that I think is often lost. But again, I say we're all standing on the shoulders of giants. When Joe retired from USDA in 2017, he tossed that ball to Casey Barton Barovich at CDC. So we'll mention that office again soon too. And I just have to mention the 2004 12 Manhattan Principles because they really are one of the early building blocks of this One Health conversation. And it was led by organizations like the Wildlife Conservation Society and the Rockefeller University actually hosted this meeting. So the U.S. Geological Survey and the National Wildlife Center, all those groups had representatives who worked together to create these 12 Manhattan Principles that really evolved into their statement or adopting the holistic approach to combat the threats of health uh, to the health of life on Earth under the banner of One World and One Health. And I will mention this again, but I just have to be sure everyone is aware of those. And when you go back to a PDF of these slides, all these links should be active. So I have to mention that. And a lot of people don't realize that a lot of the early meetings in the One Health space actually happened in South America and Brazil. And we'll be mentioning Brazil again because they're really doing a great job now. And even in 2011, I don't know if you can see this, but down at the bottom, you can see the FAO and WHO and OIE logos and then a United Nations logo. There was a high-level technical meeting to address a One Health, basically, meeting in Mexico in 2011 that most people are not aware of. And the reason I mention those logos is that for many, many years, um, starting in 2010, we referred to a One Health tripartite. Some of you may remember that. That was the FAO, WHO, and the OIE, which is now, of course, WOA, the World Organization for Animal Health. They had written declarations in 2010 and in 2011 declaring to try to work together in this One Health framework. So that was pretty significant. But, as we started realizing a number of years ago, what was missing? So the environment was not deliberately being included. So it got added. I guess I didn't get that slide back in here quite in place. So it got added later. We'll touch on it again in a moment. Some of you are also probably familiar with the One Health Initiative group. It's a pro bono team. They never incorporated into a nonprofit. It's led by my dear colleagues Bruce Kaplan and Laura Kahn and a whole like Craig Carter's one of the advisory groups of that group. So they're not an incorporated nonprofit, but they have done an incredible job educating the kind of a grassroots effort, educating about One Health. So you may run across the One Health Initiative webpage and know that that's just a really great resource, especially for One Health News. They have a news feed too. And then some of you may know that the One Health Commission was actually started out of an effort that was a joint One Health Initiative task force started across the AVMA and the AMA back in 2007, because Roger Marr was the AVMA president and Ron Davis was the AMA president, and they helped start this One Health Initiative task force. Also involved in that effort was Lonnie King, who was at CDC at the time and actually was the person who proposed a One Health office at CDC, which happened very quickly. The One Health Commission that I lead was actually created in 2009. And then that CDC office also got started in 2009. A number of things happened in the One Health space in 2009. And I'm sure most of you are familiar with and work closely with CDC and already know about the Zoho calls. That's just an amazing resource for anyone working in public health. And then I'll just mention that a lot of people I find in the field in public health aren't aware and that they could be tuning into this. I also cannot have a talk like this without mentioning the Emerging Pandemic Threats Program. I know when you're working locally in public health, you may not be paying attention to some of the global issues, and I find the same thing with my colleagues who work mostly in global health issues. They're not very familiar with local One Health issues, so we really need to work on that just for awareness, because there can be things that we can learn in both spaces to help each other. But USAID launched the Emerging Pandemic Threats Program in 2009. There have been several iterations now, EPT-1 and EPT-2 and EPT-3. The most recent iteration was the One Health Workforce. And I mention this because it's had such a profound effect in my mind on the global One Health movement. You can see the AFRIHUN, which used to be called the One Health Central and East Africa One Health University Network, now called AFRIHUN. You can see the countries here in Central and East Africa that were involved in. I have to say that Dennis Carroll, when he stood this up, he framed everything in One Health. So he basically took One Health thinking to the continent of Africa and also to Southeast Asia. So there's also a Southeast Asia One Health University network that emerged. And guys, I have no idea how they're faring now, now that USAID is no longer in the picture. But it had such an impact in my mind because this map down in the bottom right, you can literally see that area there in Central Africa and over here in Southeast Asia, where the seeds for One Health had been planted. And this is a map from our One Health Day, the first One Health Day year that we ran in 2016. So if you want to understand who the players are, just have to be sure that we appreciate some of that early work, because there's none of us do any of this work in a vacuum. We are all joined by those of us really pulling together on this road. So we did launch a One Health Day. It was the One Health Commission, the One Health Initiative, and at the time, One Health Platform, which later closed early in the pandemic and then was reborn as the Global One Health Community. So we'll mention them again in a moment. They are the ones that lead the World One Health Congresses that have been going since 2011. We were blown away that first year at the number of events. This is the map for the first year, the number of One Health Day events that were held all around the world in the very first year. It's just been so gratifying to watch this. And now we are in our 10th year. The events are starting to roll in right now. I'm approving more and more every day to get the pin on the map. But you can see that even during the pandemic, people all around the world were finding ways to lead events, to educate locally, and sometimes online, internationally. In fact, a lot of online during the pandemic. But it's just been amazing to watch this happen all these years, and now we're in our 10th year. So I hope if you have led some One Health events this year, they don't have to happen right on November 3. They can happen any time of the year. Just register them to celebrate them for One Health Day and get your events, whatever they were, from a brown bag lunch to a full-blown conference. Get a pin on the map and be sure that you and your organization and your area and your region are represented on the One Health Day map. I'll just mention that we did also create student event competitions and the One Health Day, and that's been really fun to watch students put together teams. And interesting, last year it was a high school team that won this. It was absolutely amazing. So it's really maybe the second time we've ever had a high school team even throw their event in to compete. So just really fun and really valuable efforts for these young people as we work to really nurture the next generation of One Health leaders. Another fun thing that we lead is a One Health Awareness Month. It was actually um, it was a takeoff from what Deb Thompson, who was an AVMA Congressional Fellow back in 2019 and 2020. The pandemic really kind of messed up her fellowship, but she was able to get a resolution passed in the Senate and Senator Einstein's office to make a resolution to make the next January of 2020, when the pandemic was hitting us, to make it a One Health Awareness Month. And we put together this One Health Awareness Month campaign, and we have been so shocked that it took off. And people all around the world do celebrate One Health Awareness Month. It's mostly in online postings of social media. We put together this calendar so you can just pop in and grab something to go put on your social media. So I hope that you might think about participating in One Health Awareness Month too. So, as I mentioned, we had a tripartite for a number of years, and then we added the United Nations Environment Program, and now we have a really fun, fancy word, the quadripartite, the One Health quadripartite. And that quadripartite has stood up a One Health high level expert panel. I have heard people mistakenly say that this OLEP is made up of representatives from the quadripartite organizations. That is not the case. The OLEP is made up of One Health experts from all over the world, and they serve in an advisory capacity to the quadripartite, and they're incredibly prolific. I mean, this is just a handful of all the publications that they have put together since starting in 2022. One of the things they put together was a new definition, or hopefully a consolidating definition for One Health. In my mind, it's just a little too long, but it's not going to really work on an elevator. So you still need to work on your own elevator pitch. But I've circled here something that I think is really important. This communication, collaboration, coordination is where we're really kind of struggling in the movement right now. We've got a lot of groups, a lot of people doing a lot of amazing work, but we're not doing very well at really knowing who's doing what and finding ways that we could synergize and become force multipliers to really help and support each other's efforts. So just mention that for you. One of the things they helped create was a One Health joint plan of action that I think you would find might even inform some of your own work. So I suggest you take a peek at that. And then the organization that I mentioned, the Global One Health Community, that was the rebirth of what was formerly the International One Health Platform, has been leading these World One Health Congresses. And people often reach to me and the One Health Commission thinking that we lead the One Health Congresses, and I really don't want anything to do with leading a conference. It's just way more work than our funds would support. But these have been going on since 2011, 11, 13, 15, 16, 18, 20, 22, and 24. And I've been fortunate to go to the 15, 18, 20, and 24 one. Excuse me, not the 20. The 20 was online. That one had to go online. But the 22 in Singapore, and then last year in Cape Town was probably the best one I've ever been to. I don't know if it was because it was in Africa, or if it's because there were a lot more women involved in planning the conference. But the energy at that conference was really palatably positive. And this is just a couple of snapshots. This is our One Health Social Sciences meet up. This is how many people from our One Health Social Sciences Network, that's one of our working groups, were at that Congress, and we had a little meetup. And then I'll mention again in a moment the Women for One Health. I'm hoping some of you might want to go get involved. And this is me, yours truly, over here in the conference. So it was it's a really great experience. It's very research oriented, but ministers of health and basically anybody in the One Health space shows up at these meetings. Um, so the next one is in Lisbon next year. It's going to be in September next year in Lisbon. I'm hoping to get to go. Um, I want to talk a little bit about some of the top-down efforts, at least in this country. I'm not going to be able to speak terribly knowledgeably about many of the countries, although we will mention the countries that have adopted strategic One Health action plans. The first thing I was aware of was a letter from 6 senators in 2015 actually urging the Obama administration to create a U.S. One Health platform or framework and also a United Nations one. And you'll notice the One Health Commission wrote a letter very similar in support. Very interesting. I had to submit it online, but I also mailed it and I never heard anything back from either of those. So I'm assuming it made it to the White House. But that effort was just the beginning, because then in 16 and 18, in the Senate, there were bills introduced. I'm not sure if I can read this very well, on establishing an interagency One Health program. Both of those were introduced, but they were not introduced in a bipartisan way, and they only made it into the Senate. Although we were very excited to have One Health then incorporated into the language of the congressional record. And I'll just pause and mention here the outbreak exhibit at the Museum of Natural History of the Smithsonian. The reason I'm mentioning it to you now is that it was launched in 2018. The pandemic got in the way. They closed it I think in 2022 or three, but it's not gone, because this exhibit, it's a fabulous exhibit starting out with the 1918 flu pandemic and leading you through a whole number of these zoonotic pathogens. The reason I'm mentioning it is that there is a pop-up version that travels. So this exhibit has literally gone all over the world. They provide you on a thumb drive all the exhibit information, and you can actually, for those around the world, they can change the language, they can, they can customize it to their area. But that pop-up version is actually on display in the Museum of Natural History in Washington, D.C. now, and it's not still the full wing of the museum like it was back 2018 to 2022, but it is there. From what I understand, permanently, it's there in the pop-up version. So if you get to DC, go look at it. And for goodness sakes, guys, think about bringing it to your area. Put it in a library or a hospital lobby or put it in the mall, bring it to your area and let's use it. Continue to use it to teach about One Health and One Health issues, especially on the heels of the pandemic. So back on the top-down trail here in the United States, in 2019, for the very first time, we had introduced into both the Senate and the Congress in a bipartisan way, both Democrats and Republicans supporting this, a One Health bill that was again calling for an interagency One Health program. And so that was pretty exciting. It went to committee and didn't leave committee, but it did make it that way. And that year, we also stood up a One Health coalition of organizations and academic institutions that said, yes, we are all for One Health and we support this bill. And, they've been part of our network ever since. So just make you aware of that. And then, amazingly and incredibly and excitingly, in 2021, it happened again. In both the Senate and the House, in a bipartisan way, a One Health bill was introduced, again calling for establishing an interagency One Health program. So that was very exciting. Again, it went to committee and not much happened after that. But by that time, you know what was happening. The pandemic was going. So when I would go to DC, I no longer got the dull blank stare from lawmakers and people in DC, because they were starting to know what these words One Health were and what it was all about. And some of you might be aware that Senator Gillibrand's office actually very quietly introduced a One Health Security Act also in December of 2022 that you might find really interesting. That act was really trying to level the playing field for funding across the agency, so that because we don't have a CDC for animals, so that the Department of Interior and the agencies that might be able to create some kind of biosurveillance or what might be emerging out of wildlife would be able to function more efficiently. So you might just find that interesting. Of course, it didn't go anywhere yet, but just be aware. And then our National Biodefense Strategy and Implementation Plan in 2022 actually incorporated One Health all the way through it. Some of you might have been involved in consulting or have maybe read this. I know some of my colleagues in DC, before the most recent loss of a lot of our colleagues, were actually involved in providing input for that. And then on the path to what we now have as a National One Health framework, there was One Health, a call for One Health Incorporation starting back in September of 21 in that National Defense Authorization Act. My understanding is some of that was written into a report, so it wasn't actually in the act proper. But then in uh, December of 22, the Omnibus Bill, the Consolidated Appropriations Act for 2023, these dates do get confusing. That's where that language calling for USDA and CDC to actually put together a report on One Health in the US and to outline a path forward for One Health. And that is what led us to in the process, things like the National Public Health Strategy to prevent and control vector-borne diseases, and then just January of this year, the U.S. One Health Framework, which you're probably not hearing too much about right now, but know that it is there. And we hope to lean on it and make more noise about it eventually. Mentioning that federal interagency One Health workforce, kind of following that thread when it was tossed to CDC to lead, it became the Federal Interagency One Health Network. And then early in the pandemic, it was the Federal Interagency, the One Health Coordination Committee. And now in the One Health framework, it has emerged to be a U.S. One Health Coordinating Unit. So I'm very excited to kind of see where that can go when the time is right for us to bring it forward. As of November last year, I know this is a terribly boring slide, so I apologize, but all these agencies had One Health pages. And I haven't revisited them recently to see how many are still there because I know that we have lost a lot of One Health leading colleagues from our government agencies, but hopefully we can survive this pendulum swing and keep One Health strong. Most of you I know are from public health, so many of you are going to be members of the APHA, and you probably are aware that there is now a One Health section. It started out as a veterinary public health special interest group, and it grew up to become a One Health special interest group and then to become a One Health section. There's a beautiful One Health policy statement that was, I think it was actually penned by Catherine Mashalaba. But that's a really beautiful read if any of you would like to find it on the APHA website. And of course, AVMA has been a very strong supporter, actually helping to kind of launch the initiative and co-lead that One Health Initiative task force. So those of us who are veterinarians know that it's been a real prominent theme for AVMA, although we do have some room for improvement. So stay tuned and stay involved. The National Academies of Science, Engineering, and Medicine, actually has the forum on the National Academy of Medicine, the forum on microbial threats, actually has a One Health Action Collaborative that has done a number of really interesting projects. So that's interesting to watch. Many of you will be aware that the Association of Fish and Wildlife Agencies started a One Health initiative back in 21 and released their white paper in 22. It's another very interesting read. I haven't touched base with them recently to see what all's going on recently, but that's very exciting to watch. A whole handful of states have actually done One Health Month or One Health Day proclamations. And if you're interested, it's not that difficult to do in your state. The ISOHA, our colleagues at ISOHA, the International Student One Health Alliance, Neil Vizot actually put together a little how-to if you would like to make this happen in your state. So if that link is not working, because the last time I tried it, I needed to reach to Neil to see if he could find a way to reactivate it for us. But that's also been really fun to watch. And in 2019, ISOHA's leadership and the One Health Commission, some of you may remember this, and some of you may have participated, led basically One Health collaborations in U.S. state and local government and policy webinar series. It was an hour, 2 days in a row, and we heard from Harris County and Idaho and Los Angeles and Minnesota One Health and Nebraska One Health and the North Carolina and Texas and Arizona and Connecticut and Kentucky and Tennessee and Alaska and Massachusetts and Uxbridge. We need to do this again because I know you guys are doing a lot of exciting things that would really update us, and we might have to have 3 days in a row or a longer time. But if you have time, go and look at these links. They should be active. And you can see the slides. If you have trouble with the recording, let me know and I'll try to get you access to it. But the slides are very informative and they're posted on that web page. So just to make you aware that was a very fun and exciting thing to do because we knew there were things going on in public health departments. We just didn't know exactly what. And some of you are aware that New Jersey was the first state to legislate a One Health Initiative task force. California has actually had a One Health Act passed, but evidently not funded yet. So still kind of working on things in California. State of Washington has been doing amazing things. They started their One Health Steering Committee back in 2014 and most recently have actually done a One Health Needs Assessment Report in 2023. Pennsylvania has recently created a One Health consortium that's made up of academia and state government agencies. So keep an eye on what they're doing. They have actually been leading their own conference now, so that's been fun to watch. State of Illinois has just recently created its own One Health effort, and guess what they're calling it? They were going to call it a One Health Task Force, but they decided to call it the Illinois One Health Commission. So you guys can see, and you'll see even more as I keep talking, that there can be some confusion among names because we don't always just pay attention to what's already out there. Delaware's public health is leading One Health, and is actually Doug Riley has been spearheading this One Health regional consortium. They meet periodically and they lead a conference. And right now, evolving, there's a Georgia One Health Consortium, which is evolving as we speak. And I think I just found this webpage. So Jessica Schwing at Georgia Southern University has been kind of spearheading that. So keep an eye out for that. And then some of you may be aware that a North America One Health University Network was launched last year. This is really exciting to me because I've been trying for 10 years to figure out who's doing what at the different academic institutions all over the world, but to actually be able to find more out about it, about all these academic institutions in the North America is very exciting. There's also recently been launched a Canadian One Health University Network. So it's basically just pulling together a lot of the people all at the different academic institutions across Canada together. And they also have a global One Health network. And there are a lot of things going on in Canada that we could talk about if we had time. So one of the things that the commission did back in 2014 was lead a who's who. We actually did it in 2014 and 2016. Lead a who's who in One Health webinar series. The first one ran all day long. We couldn't believe it. 1,000 people tuned in, and most of them stayed with us all day because they were so thirsty to find out who's doing what. And we had people from all over the world. One of the fun things we did was in 2019 we led a webinar in Spanish, and I have no Spanish, so it was very frustrating for me. We led a webinar for all the One Health colleagues across South America, and we found out that there's so much going on there, but the language barrier has been getting in our way. And out of that webinar, which was supposed to be a 1.5 hour webinar, turned into a 3 hour webinar because, interestingly, people were finding out about it while it was happening, and we had a Google form submission, and people kept uploading their slides because they wanted to jump in and present. That's what happened to Maria. I'm not going to remember her last name in Cuba. She jumped down and presented about One Health efforts there in Cuba. So out of that initiative emerged a network, the OLAIC, or One Health One Health Latin America, Ibero, and Caribbean network. And when we were first trying to decide what this should be called, it was going to be Hola, the One Health Latin America network. But it has turned into a very powerful, basically an informal WhatsApp network. But I'm amazed because that very informal network across 23 countries, at last I heard it, maybe more, is actually doing so much that sometimes it gets more done than a lot of the fancier, more formal organizations seem to. So just be aware that we're trying very hard, all of us, to connect us. And here's another one of the confusing names. Some of you may have been following. If you follow the international scene at all, may have been following the Lancet One Health Commission. Now, the Lancet it launches a lot of commissions. It's launched a Planetary Health Commission and a number of other commissions. So it made sense that they would launch a Lancet One Health Commission, but it's very confusing because there's us, the One Health Commission, there's the Global One Health Community, there's now the Illinois One Health Commission. So you just kind of have to pay attention and figure out when you see these names, okay, who is that and what are they doing? And that's one of the things that the One Health Commission has been trying to do. So the Lancet One Health Commission has recently launched a very powerful publication harnessing our interconnectedness for equitable, sustainable, and healthy socio-ecological systems. I urge you to go take a look. It's another high-level look at what we need to be accomplishing and what we actually need to be doing in this space. And make you aware that in 2021, some of the same players that were involved back in 2004 to create the Manhattan Principles actually came together again and updated them with the Berlin One Health Principles. So go and check those out. And then in 21, we were getting rumbles that the G7 and the G10 were actually the words One Health were being tossed around. So that was pretty exciting. And then in 21, we were getting rumbles that it had been tossed around at the G20. That was pretty exciting. In 2022, the quadripartite actually supported the Lombok creation of the Lombok One Health policy brief when this was actually held. I never can remember the country that Lombok is where it is, but that was exciting that they literally brought forward a Lombok G20 One Health policy brief from the G20 meeting. And then in 2023, India was hosting that year, and they literally themed the G20 One Earth, One Family, One Future, and again brought forward at the G20 the whole One Health concept. So some of the things going on internationally. France, the government of France has supported the creation of PREZODE, which is preventing zoonotic disease emergence. And they've been very active in leading projects all around the world, but especially there in France. And then the GIZ, or it always kind of blows my mind when I'm talking to people from other countries because they say Z, GIZ. The German government stood up a lot of One Health initiatives out of the GIZ, or the German Corporation for International Cooperation. So that's interesting to watch. They're actually the lead for this Costa Rica Alliance for One Health, Selva Maya. They've been really stirring the waters for One Health there. And there's a Caribbean One Health Alliance that has formed up. So, guys, there's just so much going on in parallel. It's just why you're getting whiplash with me telling you about international stuff and then zooming you back to the US. PAHO released its own One Health policy in 2021. Cuba has also published and done quite a bit in the One Health space. We don't hear about it as easily, but it's there. In Canada, their Royal Society of Canada, which is kind of like our National Academies of Science, Engineering, and Medicine, they have a One Health working group, and they put out a really strong report in 2022. I'm going to have to go fast so you guys can ask some questions. Colombia has introduced a bill into its Congress. I don't think it's gone anywhere, but it's been introduced. Brazil has really, they've got their own steering group and they're very close to creating their own National One Health Strategic Action Plan, and recently has stood up a Brazilian One Health Association. I just want you to be aware that this Women for One Health organization, it's a fabulous network, guys. Get involved. And it's not just for women. There are men involved also. It was created to try to level the playing field, if you will, because they were noticing that a lot of that women were getting left out, especially out of some of the higher level organizational things, because women are not always in jobs that have a lot of money to travel them to big conferences. So it's a wonderful, wonderful network. I urge you to check it out. And please sign on and get involved, and you can follow the network. In our One Health happenings, we're able to bring updates literally from all over the world. I get reach outs from South Sudan and Pakistan routinely because they realize that we're sharing news about One Health in the One Health space. So, very exciting. We put this map, I want to draw your attention to the one on the left. With the green countries, those were the countries that we were aware of and are aware of because we have updated it, that have formally adopted at government level a One Health Strategic Action Plan. Now, the map on the right, the orange countries, that's formally adopted One Health Antimicrobial Resistance Action Plan. So we've done a bit better there. But I want you to look at this map on the left and tell me what's missing. Nothing is colored green in the Western Hemisphere yet. So we'll see who actually gets to where we feel like they're actually implementing One Health. I know Brazil might beat us. We'll see. We're running neck and neck. And then, of course, we're all dealing with H5N1 and cattle and cats and all sorts of creatures. And I just got to tell you guys, the rest of the world is watching. This is a really interesting report written by the former Prime Minister of New Zealand and the former President of Liberia. And they're watching. I mean, one of the statements was the highly concerning bridled response thus far of the U.S. to the One Health. I mean, to the H5N1 outbreak was very concerning. So the world has been watching, and we better be paying attention. We need to all be paying attention not just to what we're doing, where we're doing it, which is so important, but also how we fit into the world and how we need to make sure that we're filling the gaps. So I'm going to take about 30 seconds to tell you a little bit about the One Health Commission because I want you to know about some of the opportunities. Um, we turned 15 years old last year, if you can imagine that. And we definitely provide opportunities for groups and organizations to get involved in leading. So all our working groups are just whoever steps forward, who's willing and able to lead. And then again, it's this very international movement. We've led all sorts of webinars. One of the ones I was going to tell you about was that one of all the public health, um, the webinar we did highlighting all the public health groups that were actually leading One Health programs. So these are some of the working groups that we've stood up. We have a bat rabies education team, a One Health education group, the One Health social sciences group, and a spinoff of that is the OHSS food safety and food security group. And most recently, this really fun, exciting group of OHSS human animal bond group. So that's been fun to watch because this gives opportunities for people who might not have an opportunity in their day jobs to get involved in actively leading for One Health. And again, this is our social sciences group last September at the Cape Town meeting. Of course, we continue to lead on One Health Day. We've just launched, well, we've had launched, and I hope events are starting to roll in. And we did also facilitate the creation back in 2017 of the International Student One Health Alliance. They created themselves as an independent organization. It's been really fun to watch, and I have continued working with a number of those original leaders. So that's been fun. And we lead a Bossert Scholarship in memory of our dear colleague, Greg Bossert at the Georgia Aquarium. And this I really want you guys to be aware of in case any of you are academicians or on faculty at schools of public health. We had prepared a curated page of One Health's resources to help schools of public health meet the mandate by the Council for Education for Public Health. Back in 2016, they mandated that all graduates with an MPH would be aware of One Health. It basically says, explain an ecological perspective on the connection among human, animal, and ecosystem health, or One Health. So that's pretty exciting. And please take advantage of those resources and let me know if you have any observations or suggestions. Again, this is that map. I just wanted to put it in your brain again because I want to ask you this question. What do you think's been missing? I think we've been missing a lot of the grassroots, bottom up, community driven, general public, local understanding of this concept. And we've been yelling at each other as scientists for 20 years, but we haven't really yet helped the general public understand what we mean by One Health. And so this is where I think you guys and veterinarians across the US and everywhere have a real critical role to play. So this is my call to action for veterinarians, whether you're in an exam room seeing patients or whether you're practicing public health. You guys are in a position to be aware of the occupational health risks that veterinarians and animal health workers are experiencing and help educate about it. You're in a position to help educate the public. You can lead One Health events. If you're in an exam room, you can bring up One Health topics in your exam room. You can develop relationships with your local veterinarians, your local pediatricians. If you're in a public health department, you can go out of your way to make those relationships that would help address One Health issues in your local community. For example, years ago, when I was in practice, it occurred to me that we really needed to make leptospirosis a reportable disease. And I don't know how many of you are in states where lepto is reportable, but it is not in North Carolina. And I got the impression that getting a disease made a reportable disease took an act of Congress itself. So you guys are in positions to work on things like that. You're in positions of leadership in your local communities. Um, and you can create those partnerships with other local health practitioners or even, your water sanitation people, anybody who's working in a space that you might overlap with and your edicts and your areas of responsibility. You can share educational materials. As public health departments, you're in a great position to do that reach out arm to the general public. Um, you can put brochures around bat rabies and vector-borne diseases and healthy chickens, which I know a lot of you already have, healthy chickens and healthy habits for people who have backyard chickens. So this is my call to action, guys. You can use these maps. They've been updated, I believe. These are from 2018. You can see that you can overlay the CDC Lyme disease map with the Companion Animal Parasite Council map of dogs that have had antibodies to Lyme detected. And this is really powerful to realize that if we pay attention to what's happening in dogs and use this concept, this One Health concept of animals as sentinels, that we can really help advance the health of the humans also. But as it is right now, most of the time we're letting the humans be the canaries in the coal mine because we don't have the systems in place to really pay attention to some of those overlaps. So I urge you guys to think about these kinds of things that you in your public health space can do. I don't know if you're working for the state, you might not feel comfortable meeting with lawmakers, although they really need to hear from you. But we need to find ways to explain why it's so important to look for a way to do biosurveillance of companion animals and wildlife because we don't have a CDC for pets. So this is my call to action to you guys for becoming One Health champions. So I really want to thank you for listening. I really appreciate the opportunity to share all this with you, and I look forward to hearing some of your questions.
I will go ahead and we'll start the Q&A. So questions in the Q&A. We have a question. One of our attendees remembers how the One Health approach trickled down to the veterinary medical associations, and it's become a bigger part of the AVMA convention. Where do you, Dr. Stroud, see our biggest challenges to overcome today?
On a global scale, I have to tell you guys, because I get to do this high level 70,000 foot view, I think the rest of the world's doing it a whole lot better than we are right now. And has been for some time. AVMA has been out front leading with its One Health tracks, and that's been very exciting. But even there, I still run into veterinarians in the halls at the AVMA conference, and veterinarians in the hall sometimes still ask me, what is One Health? So we obviously haven't done quite a good enough job. And that's where those of you working where you're working can also help us. Our greatest challenge is awareness. And then right up there next to that is funding. Until we can help those people who are in charge of the funding streams understand the urgency of tying together these human animal environment components at the highest level, at the level of, conceiving the funding stream, that's all, it's going to be a challenge because in our current systems, academia doesn't necessarily reward those of us who are trying to work across disciplines, and it's just been very challenging. So we have to just keep swimming. It's hard to say what is the biggest challenge, and it's kind of whether you're talking about globally or in the US. So I mentioned some of what I see as challenges in the US. Globally, they're very similar. Even though the quadripartite is trying really hard to work together, there are still funding issues. And probably if I had to say what is our biggest challenge for the whole One Health movement, I would say our Achilles heel is we're not connected. We don't know about each other. How are we ever going to join hands and synergize our efforts if we don't even know about you yet? We even give our new organizations names that have already been taken because we don't know they exist. So those are some of the challenges. Thank you very much for that question and for thinking about it with me.
Okay, I've got a question here regarding you mentioned the OHLA. Do you know if they have a role in the response to New World screwworm in Central and South America at this time?
Ooh, that's a really good question. I don't know. I'm guessing many of the people in that network are involved, but guys, that's a really scary challenge. Um, I don't know. I do not know. I don't know if any of them, because most of the people in that, excuse me, in that oleic network, they're doing research. They're in the academic research arena. So I just don't know. I could probably feel that question to some of my contacts in that network, but that's a really, really good question.
One of the attendees asked, have you had any connections to the international work on eco-health or ecosystem approaches to health that were being more widely accepted and promoted around the same time that the concept of One Health was growing? Okay.
Yeah, there's an um eco health organization that one of the in NEO, the Network for Evaluation of One Health, actually folded itself into the Eco Health organization. So they're kind of doing a lot of overlapping work now. So it's now the Network for Eco Health and One Health. So that was led by some colleagues, Sam Sam Ruig, I think is his name, and Barbara Hess, and some of they're veterinarians because many, just like here in the U.S., around the world, there are a lot of veterinarians leading this. Although I do at the World One Health Congresses see more MDs, especially ministers of health, who show up, and I see an awful lot of PhDs, pure PhDs, who don't have any clinical background showing up at those conferences too. It's really so amazing to see so many people. I feel like when I go to that Congress, in fact, somebody said this to me last time. I bet you feel right at home here, Dr. Stroud. I said, yeah, these are my people because everybody there, you don't have to explain to them what One Health is. They got it. They understand it, and they're there trying in their own way, in their area, in their location, from Bangladesh to the Balkans, they're trying to lead for One Health. So that to me has been one of the most exciting things I've seen is to see all these groups stepping out to lead all over the world.
We have someone asking about the traveling outbreak exhibit. Is there a point of contact or a way
Yes,
that
there is, and I would be delighted to connect you with them. I think you might find it on that slide. So I will, Eric, send you a link to a PDF of these slides. Please reach to me, cstroud at onehealthcommission.org. You'll find me all over the One Health Commission webpage. If you have any trouble finding that, because there is there is a point of contact that I can give you an email for. That would be awesome. I have been talking about this for years now, and I would love to know that somebody has brought this exhibit to their area because they heard me say something about it. Because a lot of people don't realize either they didn't realize it existed to begin with, or they thought it had closed down and it's not still available, but it is still traveling around the world.
one of our colleagues, first of all, says excellent presentation and motivating. Do you have any comments on how veterinarians can further support food security at a regional or national level?
Oh. Other than all the education that you already have, just trying to find ways to take it to the public and to lawmakers. I mean, food safety and food security to me are very different topics. Food security is about availability of food. And as far as practicing veterinarians, unless you have a way to get involved with second harvest or something like that to find ways to get more food to the people they need it, I don't have any specific answers for you. But your educational background and sharing information with whoever you come in contact with on that topic, if that's a topic of your interest and passion, um, I'd be happy to talk with you. Our One Health Food Safety Group has been leading webinars, really fascinating webinars from people all over the world talking about some of the issues of around food security and also food safety. So I would love it if you would like to get involved in that group. I would urge you to do it. It's a huge area for the One Health conversation that really needs us right in there leading. It's the reason we stood up that group because we'll do anything we can think of to help educate on those fronts.
All right, another question that mentions planetary health activities. Do you think the One Health movement could or should be doing more with respect to climate change? And then linking with the planetary health activities.
Oh, absolutely. So, I have worked closely and followed the planetary health movement. They started out specifically to create a new profession, which is good. The work that the planetary health movement is doing, in my mind, is really more at the human environment interface, what humans are doing to the environment and how the environment can affect human health. By their own admission, they don't really factor in too much on the animal front because there's so much need on the human environment front. So, in my mind, we are pulling on the same rope as kind of sister movements on the same rope in the same direction. And yes, we definitely need to be linking up. Um, I'm part of a Planetary Health, One Health discussion group that the Consortium of Universities for Global Health leads. And unfortunately, my bandwidth won't allow me to get too active in too many things. But there have been a number of things that we've been trying to do through the years to try to help us. We really need to join hands and we really need to be doing more together. If you'll notice in our One Health happenings, we bring forward planetary health newsletters and planetary health topics pretty often. I do not know if that's happening from the planetary health side of things. So it's again one of those systems things where we have to find ways to get out of our comfort zones and create the opportunities. So if you're in a position to do something like that, to bring your One Health thinking to the planetary health movement, please do. It's very important that we work closely together. Here's
So
one somebody said that it seems that veterinary and public health and less so ecology are the ones who really promote One Health, and that the human docs and medical docs don't seem to know about it. You are so spot on. That has been such a challenge. When I first came into this One Health space, the veterinarians had picked it up. In my mind, it emerged out of the biodiversity and conservation medicine discussions, even from the late 90s. And when the veterinarians picked it up, by the 2006, 2007, when AVMA and AMA picked it up, by then the veterinarians had picked it up and were making a lot of noise about it to the point that other health professionals were going, oh, that's just the animal folks tooting their horn. It doesn't have anything to do with us. So I spent the next 10 years trying to overcome that perception. So now we're seeing more and more human docs, if you will, who are starting to get it, but I can still count the ones I know, at least in the US, on my fingers and toes. And like I say, it's much better internationally, but it's a huge challenge, which is why I'm throwing out this gauntlet of a challenge for those of you listening to help us work on this. You're in a position where you probably could, and what it takes is just somebody being willing to step out front and lead and go and talk about some of these topics, and don't start by hitting them over the head by what is One Health, what we need to do. Give them a story of an example. I've got a whole talk of stories and examples of One Health, and take one to a colleague that in another profession that is at the intersection of something you do, and say, "Hey, what could we do together on this?" And create those relationships, because the human medical docs, it's been such a challenge to get on their radar. If you think about how intense their days are, seeing a new patient every 20 minutes. And I mean, I was in veterinary practice. I know how intense that was. And somebody come to me say, "I've got this new thing called One Health. I want you to start promoting." I would have gone, "What?" So it's just a matter of us helping the education and the understanding. We have to keep swimming. One of my colleagues said recently, and I'm going to repeat this because it means so much. She said, "Cheryl, it was Dr. Christina Pettenbrewer. She said, "Cheryl, it's not who was first, it's who continues in this One Health race, or this One Health marathon, to really help us get to the point where we really understand where One Health thinking can become the default way of doing business." So it's not who's first, it's who continues. We must continue.
Well, I think we have come to the end of our questions. Oh, here's the last one. Would you like to comment on the importance of emphasizing that the One Health Triad is an equilateral triangle, meaning that human health, animal health, and environmental health should equally benefit from the One Health principle?
Absolutely. Even One Health, guys, all these years I've been working in it, it still has an a human-centric focus. Like, let's find out about zoonotic diseases so we can protect people. What we have to be able to do is realize the value, the inherent value of all life, and give it equal importance. Yes, One Health implementation will protect people, but it might also protect the animals, or it will also protect the animals. And the value of the animals, their intrinsic value for biodiversity, and the importance of biodiversity for protecting us all, including the animals and the environment. That's where we really have to balance this. And I often find myself saying, "Yeah, well, that's all about people, but what about the animals?" So thank you guys for bringing that up. It is a very important point.
Well, I think we've come to the end of our time this afternoon. I want to definitely thank Dr. Stroud for a very engaging and motivating presentation today. Definitely got me to thinking a little bit more about One Health. So I will close out today. Once again, thank you, Dr. Stroud. Just as a advertisement for future webinars, we always need volunteers, great speakers like Dr. Stroud today was. And if you have anybody in mind, or if you yourself would like to make a presentation, please contact us. You can go to the ACVPM website, and the Continuing Education tab has a way you can volunteer to be a speaker or to nominate a speaker. You can also email me at admin@acvpm.org with that information, and we can pass that on to our Continuing Education Committee and hopefully get a webinar on the books for a future date. So with that, once again, thank you, Dr. Stroud. I thank everyone for attending, and keep an eye out for the November webinar announcement. Appreciate everybody's time. Have a great evening. Bye-bye.